Good morning, everyone, and welcome to the first of two 5G in digital healthcare events organised by the UK 5G Labs and SMEs Working Group. Our session today will consist of a presentation on the role of 5G in the health sector, followed by a discussion panel and a Q&A. In terms of housekeeping, your microphones are going to be muted throughout this session today, but you can use a chat functionality, which is at the bottom of your screen, to communicate with other delegates or our panelists today. You can also use the Q&A box to submit your questions throughout the session. When you submit your question, please do include the name of the panelist the question is directed to. We will aim to answer as many questions as possible, but if there are any unanswered ones, we'll try to answer them after the event. We are recording this session and it will be available on the UK 5G website as well. So without any further delay, I'm now going to hand over to Keith Robson, Chair of UK 5G Labs and SMEs Working Group, who's going to give you more background information about the group and the events today. Keith, over to you.
Okay, thank you, Ivona, and welcome to you all. As Ivona has said, this is the first of two events, with the second being held on the 9th of December. So if you haven't already registered for the 9th, you can find the link on the UK 5G website. Health and social care are in pole position to be early beneficiaries from 5G technologies, and we have a terrific range of delegates attending this event. Some of you are already experts in your own field, and others are actually here to learn. So this event is aimed at giving a broad introduction to this very important topic, and a chance, as Ivona said, for you to listen to and to ask questions of a very experienced panel. And again, as Ivona said, we'll use any feedback we get today to shape the more detailed discussions for the breakout sessions that we're planning to hold on the 9th. So your speakers today come from right across the UK. They are Adrian Smith, the Health and Social Care Solutions Lead for West Midlands 5G. Adrian will give the short overview next of what 5G is and its role in the health sector. And Adrian will also chair the discussion panel and sum up for us at the end. We also have Brendan Crossy, the Chief Executive Officer of Healthcare Analytics based in Northern Ireland. Karen Pollitt-Cham, a professorial lead of for Connected Futures at the University of Brighton. Mohammed Imran, Professor of Communication Systems and Dean of the University of Glasgow UESTC. And Peter Cunningham-Ford, who is partner and founder of Viatech Associates and an expert in the field of 5G network applications. So a really terrific panel, as I said, from across the UK and spanning a huge area of expertise. So I will now hand over to Adrian for the overview session. Adrian.
Thank you very much, Keith, and welcome all to this session. I'm just going to share my screen. I have a few slides to back up what I'm going to say. So as Keith has said, I'm lucky enough to be the Health and Social Care Lead for the West Midlands 5G. It's the largest 5G test bed in the country, supported by the Department for Digital Culture, Media and Sport. But as well as being the lead for that programme, I'm a long-term NHS employee. And so I come at this question from the health angle, not from the 5G technical angle. So there are other people on this panel who know much more about the technicalities of 5G connectivity than I do. But I want to come at it really from the perspective of what is it we're trying to do with 5G connectivity? Where is it really going to give us a benefit? What are the challenges that we're trying to address? So you can see here on the left-hand side some of the drivers for what's going on, even before COVID appeared on our radar, we all knew about the huge pressures that the healthcare system is facing. The NHS in particular, pressures everywhere in the system, on the ambulance service, on emergency care, on GPs, everywhere, a huge load on the system, and a desire within the healthcare sector to try and deliver preventative care, to try and get each of us to manage our own health and wellness better, and take that pressure off the system by letting people be healthier and by helping to avoid them going to the clinic unless they really need to. So then COVID comes along, and what it's done is really added a further pressure to that. It's added the risk of exposure, so a desire to avoid exposure in clinics and in GP practices. It's added a disinfection challenge. You go into an endoscopy clinic, for example, that it's a real challenge to get those clinics clean after a visit. But it's also made people disinclined to attend clinics. And we see in areas such as pediatric cancer care, children not attending clinics because their families are worried about the COVID challenge. So the pressures have increased even more over the COVID period. And connectivity has really always been the route to tackling that problem. If you look across the cycle of the healthcare system, whether we're looking at prevention, whether we're looking at screening and early diagnosis, whether we're looking at emergency response or helping people to manage their long-term conditions, it's connectivity that helps us do that away from the clinic. For the prevention agenda, connectivity enables us to give people the digital tools, the therapeutics on their smartphone, the behavioural nudging, so that citizens can look after their own health and wellness much better wherever they are. If we've got the right connectivity, we can do that even in the most remote and rural locations. We can also use connectivity to help with early diagnosis. We can support screening and monitoring in the community and at home, giving us the chance to provide precision medicine opportunities to react and get alerts from that early diagnosis. And of course, one of the areas where certainly 5G has been seen as a big booster is in the emergency response area. If we can make the ambulance or any response vehicle more connected and become a communications hub, then what we can do is increase its potential to see and treat people at the scene of an incident and do a better job of communicating with experts and transferring information and patient data to again reduce the load on hospital by not having to convey people unnecessarily to the clinic. And related to the prevention agenda, we can use the same sorts of tools that we're using in the preventative agenda to help people manage their long-term conditions, their diabetes, their COPD condition, their comorbidities. We can help them do all of that if we've got the connectivity again to support them accessing the data and the information that enables them to do that. Of course, connectivity on its own isn't the answer. You need other tools and technologies alongside it. And so AI and the use of big data to analyze population health is a crucial part connected into that connectivity to get the best from a system that delivers great care closer to home. And incidentally, that theme, great care closer to home, is one of the sessions we've got planned for next week. So if it's an area that interests you, please do sign up for that session. So that's a bit of the background to the challenge. What about the 5G piece in particular? Well, as I say, I don't profess to be an expert in the detail of the technology. You can ask some of our other panelists if you want to go into some of that. But for me, from a healthcare perspective, there are four things that make 5G transformational here for healthcare. The first is the bit that we as consumers generally are interested in. We're interested in speed. We want fast download, fast access to information. And that's important as important in healthcare as it is anywhere else. We want to be able to get fast access to information about patients. We want to download files with imagery on. We want all of that. And 5G, as the image here shows, is much faster than 4G ever was. We want the better capacity that 5G brings, and that capacity really connects us into the Internet of Things environment, where we can give many people, millions of people, access to the ability to share and use wellness and healthcare data, and to transfer that between the clinician and the patient simultaneously across a whole region at the same time. We want the low latency that 5G brings, because in a lot of environments, we want to be able to ensure that things are happening in real time. So the example here, for example, surgeons being able to use augmented reality or virtual reality for a real-time operation or engagement, and the low latency of 5G helps that happen. And above all else, we want efficiency and reliability. We want to be able to make sure that whatever we're doing clinically, we can sustain. And 5G gives us that. It gives us robust connectivity. And nowhere else than in healthcare do we need that. We don't want to be holding a critical consultation and find that the connectivity rumbles or disconnects or gives us a hazy image. We want all of that to be delivered efficiently and effectively. So that's why 5G is so important to us in healthcare. It's going to deliver us that ubiquitous, robust, resilient and reliable connectivity at speed and with low latency that we've always wanted. So very quickly, just a couple of examples. You'll come across many here and in the sessions when you come along next week. So because I'm in the West Midlands 5G programme, I've just picked out 2 of the projects that we're engaged in at the moment and some of the partners involved in those. There are a range of SMEs involved. So for those SMEs on the session, there's plenty of opportunity to get involved in 5G, in emerging and new projects. So the 2 that we've got here, one's a care home project, and obviously care homes high on the agenda in the COVID world that we're in at the moment. And what we're doing is showing that 5G can fundamentally enhance patient care in the care home, and at the same time deliver savings for the system and commercial benefits to the providers of the solutions by giving real-time diagnostic in the care home, not just a video consultation, but the ability to carry out a real diagnosis with a video consultation and the download of imagery and accessing patient information and linking into a multidisciplinary team, all happening at the same time, and 5G makes that happen. And the other example, again, it's a plug for one of the sessions that are happening in the next week. We have a bowel cancer session next week, a good example of diagnosis. And what we're doing there is we're taking an already existing technology, capsule endoscopy, the ability to look at whole gastrointestinal tract with a swallowable camera. And we're using 5G to take that solution and effectively put it right into the patient's home, to be able to carry out an endoscopy in the comfort, relative comfort when you're carrying out this procedure, in the comfort of a patient's own home. And the 5G enables the clinician to be there with the patient, supporting them in the process. And it also enables us to track where the devices that we're using are, so that we can get them returned and ensure that they're being used properly in the process. So they're just 2 examples of many where 5G is completely changing the way that we can work in the healthcare system. And I'm not going to go through this slide. It's just a set of examples of where 5G and also satellite connectivity is being used as well as part of the solution. Everything from satellite ultrasound stroke response to supporting diabetes structured education, the European Space Agency supporting COPD management, right through to monitoring and sharing of condition management and remote consultation. There's a whole raft of areas where 5G can be a game changer. So that's all I'm going to say. That's my 10 minutes up. I'm going to stop sharing my screen. And what I'm now going to do is I'm going to ask each of the rest of my panel here to introduce themselves and just say a little bit, a few minutes, about why they're in 5G, what's exciting about it for them, and what's their role in it. So first I'm going to hand to Brendan.
Thanks, Adrian. Hi, my name is Brendan Crossy. I'm the CEO and founder of Healthcare Analytics. As Keith said, we are an SME, a software company based in Northern Ireland. And over the last number of years, we've built up some specialist skills in connectivity, IoT, and data analytics. We use those technologies to build innovative software solutions that try to deliver on the vision that Adrian just went through there. And we've built some innovative solutions for healthcare organizations. Up to now, it's been mostly within the four walls of acute hospitals. So we've built solutions for asset tracking, deployment of specialist staff like pharmacists, and also waiting list management, management for specialist services. And we are now starting to look at building solutions using 5G for the remote management of patients in the community and sort of taking that technology outside of there. So that's why 5G is an important technology for us. And we're involved in advising a European project called SHAPES, which is a European project with 36 organizations across 20 countries looking at the remote management of elderly patients. And at the next session on the 9th, Professor Mike Scott from Northern Health Service will be discussing this project. And also just yesterday, the SHAPES project actually put out an open call for contributors, which would allow other SMEs and organizations to get involved.
Thanks, Brendan. Next, could I ask Karen, if you'd like to introduce yourself and explain what you're doing in the 5G area?
Yes, thank you for that. Yes, I'm Karen Cham, Professor of Digital Transformation Design at the University of Brighton, and I lead on 20% of our research and enterprise strategy, which is Connected Futures. As part of Connected Futures, we have a digital health theme, which, as you would imagine, is in collaboration with Healthy Futures. Because for those of you who don't know, we do have Brighton and Sussex University Hospital and Brighton and Sussex Medical School, and we're also the regional lead for the NIHR Research Design Service in the healthcare sector as well. So we were lucky enough to win one of the regional catapult bids about 4 years ago, and one of the key projects that came out of that was the 5G Brighton project. So we had the first 5G testbed off a research site, which was opening up the facility for small businesses to look at next generation products and services. So our focus within healthcare, it relates to an NCUB report from a few years ago called The Human Factor, which is about facing on patient-centered design and also the upskilling of clinicians and people in the healthcare pipeline to understand how to contribute to useful technological outcomes in digital health. So as part of that, we've had a huge Horizon 2020 project creating a secure HIV app across 7 European countries. And we've also got a mixed-use adult social care facility that's owned by the City Council, where we have a co-design project. So end users are involved in the collaborative design of technological products and services. Our 5G work is focused on what I call 5G native, which is using the technological attributes that 5G affords us, which I'll talk more about next week, in terms of creating things that have not yet been foreseen. So although we do need things to be faster and louder and more reliable, there are also unusual technical attributes to 5G, which enables the kind of things we haven't envisaged yet. And a lot of that work we do in partnership with Sussex, with Professor Maziar Nekavi, who is the only UK representative on 5G PPP. So we've got some quite significant intellectual property to share next week on 5G enabled triage and that kind of thing.
Lovely. Thank you very much, Karen. Look forward to some of that next week as well. And now, Mohammed, we're going to hand over to you. And I know you've got 2 or 3 slides. So if you'd like to share the screen.
Sorry, I was on mute. So I'm Mohammed Imran. I'm a professor of wireless communication systems, and I head communication sensing and imaging research group at University of Glasgow. And our interest on 5G is somehow focused through the Scotland 5G Centre and the testbed facility at University of Glasgow campus that Scotland 5G Centre provides. Based on this testbed facility, we are working on several use cases related to healthcare technologies, which will be enhanced by 5G digital connectivity. So the main idea is to move from the reactive healthcare mechanism to a proactive healthcare mechanism with a vision for 2050. And this requires continual monitoring through wearables or through advanced technologies, as I will just introduce, and then putting in decision making into the data that we acquire securely in a privacy preserved manner, and then implementing those decisions to intervene in healthcare for public at an early stage to improve the chances of full recovery, to improve the betterment and welfare of all sectors of the society, with emphasis on seniors of the society as well. So we have been funded by 2 program grants by EPSRC to look at healthcare technologies of future, including the wireless sensing mechanisms which do not require wearable devices. So the main idea is to exploit RF waves and 5G band and spectrum included as well, in order to monitor activity in an environment without the need of any visual cameras. And 5G, as Adrian was also mentioning, differentiates itself from 4G and previous generations with not just the capacity, but a very important feature of ultra reliable and low latency communication, which will be required in these kind of monitoring mechanisms where immediate action needs to be taken in certain scenarios to avoid, for example, damage from a fall, or for emergency response on conditions, health conditions, which require immediate response from healthcare facilities. And we are also working on exploitation of telerobotics, as again Adrian mentioned, that can transform in initial stages remote diagnosis, and then in future remote surgery and other mission critical operations as well. We are also working on enabling clinics on the wheels, so mobile health clinics or mobile health units, which can take the testing and other healthcare related facilities from hospitals to the doorsteps of those people who are less capable of visiting hospitals regularly, and also managing and saving costs for the hospitals and freeing up their estates and accommodation facilities as well. And finally, one of the main barriers that I think in the uptake of digital healthcare is people's concern about the privacy of their data that they are sharing. So we work on privacy preserved contact tracing mechanisms. So one part is use of technology to trace the contacts or trace people's occupancy or movement in office environments and shopping centers, but also to ensure that the data that they generate belongs to them and stays with them until and unless someone genuinely needs access to that data only for the purpose for which that access is requested. So that's all a brief introduction about our research activity from my side. Very happy to answer questions later in the panel.
Thank you very much, Mohammed. If you'd like to stop screen sharing, and we'll finally move to Peter. Peter, if you'd like to introduce yourself and explain what you're up to.
Good morning, everyone. My name is Peter Kerner-Ford. I'm a managing partner and founder of Biotech Associates. Biotech spends most of its time in the telecoms infrastructure world. So that's building networks, whether they be fixed, which is now fiber, or mobile. So 3G, 4G, and 5G. I've been involved with 5G since 2014. In the early days on the technical side as a non-exec director for a company building smart antenna systems, but more laterally, especially over the last 4 years on the commercial side, on the commercial strategy for 5G networks and so on. As background, I've worked in 3 specific healthcare projects. One was at the Digital Catapult back in 2018, where I put together their 5G commercial strategy. And we looked at how 5G could impact on e-health, The second was in the latter part of 2018. I was asked to be a major contributor to a global report on the pharmaceutical industry. And this was all about 5G and pharmaceuticals and then the pharma industry itself. So I spent quite a few months there just looking at the impact of 5G itself, but also looking at the industry and how the pharmaceutical industry could actually adapt itself. And then inputted and curated a 5G section on a seminar and conference called Giant Health 2019. So in terms of me itself, so I've had a fair amount of exposure. I also spend a fair bit of time analyzing the whole structure of the NHS, specifically NHS Digital, NHS X, and how technology has evolved or not evolved over the last 20 odd years, and specifically around how patients are still treated as patients as opposed to customers. But there's a couple of things I'm sort of solid on. Number one, I'm not a great fan of robotic surgery in 5G. I'm fully supportive of the disconnected operating theatre, because if something goes wrong, you want the humans actually in that operating theatre to do something and fix that problem there and then, not somebody that's 2,000 miles away. I'm also not a fan of 5G and video sessions with GPs. I can just imagine a GP doing an 8-hour day on Zoom, 5 days a week, 52 weeks a year. Every GP center in the country would have a couple of guys with white coats on in a van outside and they'd be carrying them away. What I am a fan of, though, is how we map the use of technology to our current primary care and secondary care system that we have. One of the key factors in all of this is data, patient data, and how patients get access to their data, how they can better use that data, make informed decisions on the best care for them, with assistance, not only from the care system itself, but also CCG and CQC bodies. Effectively build a concept which is very much the self-service patient. If you and I were to turn up at Cisco or Oracle tomorrow as a brand new employee, we would be a self-service employee. You get a box on your desk, it's your laptop, you get an instruction, log in here. Everything else you need to do to actually do your job, you have to go find it, fix it, install it, make it happen, all the rest of it. And I think the self-service patient would actually take a huge amount away from the NHS system itself. So connectivity is a key part to that. The other two areas I'm interested in is extending 5G to rural, the non-suburban areas for healthcare. I'm part of a consortia that's looking at 5G in rural areas in North Wales at the moment. We're working with the Welsh Government on how we can actually extend either commercial 5G networks or private 5G networks into the rural areas to better connect up patients and health services itself. I'm also very interested in as 5G is a key enabler for practitioners. And my definition of practitioners here includes paramedics, triage, accident and emergency departments to better deliver frontline emergency care. In other words, connect all of those together, whether that means you have local private networks, whether you have portable private networks that you can take with you. Just as an example today, if you take a box about that size, like that in cube, put a power supply behind it, that is a private 4G or 5G network. You can actually hand carry that. And I'm working with a company at the moment, they do a backpack version for 4G. So a soldier could actually take that out into the field. There are some components of 5G that make sense. And I think that where we ought to focus on, one is private networks. So private networks within NHS trusts, within laboratories and so on, private networks that are mobile that we take with us to major incidents. Local data. So 5G has this wonderful function called a UPF where we can actually localize all of the data to where it is captured, where it is analyzed, and where it is used. And basically that takes away a lot of the concerns with regards to security, etc. And there are two technical things within 5G that I think are actually quite interesting. One is called microservices. And this is the ability to actually spin up an application very, very quickly, including the development, say, within 3 weeks. And that application is now delivering a new service within healthcare. Well, And that is one of the areas where SMEs, for instance, can get hugely involved if we build the capability into the 5G networks to allow them to actually insert those applications as services. And microservices is not focused on enough today. And I think it's one area where we will able to actually get those 10,000 new apps that we need in the core of the network that millions of people can use, whether they be NHS employees or patients or consultants, etc., etc. The other part to this is orchestration. So I witnessed a demonstration last year between two hospitals, one in the UK and one in Italy, put together by Vodafone and Ericsson. They didn't use 5G in terms of radios, but what they did use was the core of 5G and orchestration to manage all of the complex comms between those two hospitals, whether it's video, whether it's data, large amounts of data, small amounts of data, Internet of Things, wearables, and all the rest of it, and manage it through a simple dashboard. Now, an absolute breakthrough in terms of how you manage communications on a remote basis between two different hospitals and that's it. So that's it for me. Thank you very much.
Thank you very much, Peter, and thank you the rest of the panelists. Lots of interesting food for thought in there, and I hope that for those attendees who are SMEs looking for opportunity, you'll have got just a few glimpses at some of the many opportunities that are out there, and we'll talk a little bit more about that in a moment. Please don't be shy. Put your questions in Q&A for us, because we're delighted to have any questions that you've got thrown at us. And in fact, before I open up a little bit to the panel, I'm just going to answer one of the questions that came into the chat to my presentation, because somebody asked the question about fears about swallowing cameras. So this is an unashamed plug for the session next week. There's a whole session about bowel cancer, and the capsule endoscopy piece will figure in that. We've been swallowing cameras for nearly 20 years now, certainly more than 15 years, with very little difficulty and with very little harm to the environment. But we can pick up on that next week. So if you'd like to come to that session, please do. Just to get the discussion going though for now, Karen, perhaps I could start with you. We've talked about the improved performance of 5G compared to 4G. And some of the things that you touched on, I think, relate to product or service design perspectives here. What are the different things that SMEs need to think about and consider when they're trying to develop products or services in a 5G environment compared to a 4G one?
Okay, great question. I think this was the purpose of the 5G Brighton project, really, was for us to collectively investigate the answer to that question. So when I give you a very succinct and useful answer, as Mohammed said earlier, it's as a result of huge amounts of teamwork. Effectively, the features that are unique to 5G that we haven't designed for before are the important features, let's say, are network virtualization, network slicing, and mobile edge computing. And before everybody just zones out, because that doesn't sound like something they could maybe apprehend or work with, it effectively means part of the communication stack, which is the infrastructure that delivers all this transmission of information, is now virtualized. It's now software instead of hardware. Okay, so that allows us all sorts of opportunities in terms of the things that software does that hardware doesn't. For example, you can scrape data from software, but it's also likely to be open to more risk, cybersecurity and privacy risk. So that's where that narrative comes from. The network slicing is attaching a dedicated kind of, excuse me, telecoms people, a kind of dedicated telecoms TV channel to a product or a service. Now, what I'm interested in is attaching a dedicated TV channel to an end-to-end experience. So that could mean that your experience of your healthcare is not only joined up and we're interoperable with the data, but you've got a real-time access to your records under certain given circumstances. So does that try and turn a light bulb on? Because it's a conceptual shift. And I've worked with designing for new technologies for 30 years, and it was a conceptual shift for me to get a perspective on understanding what this type of environmental three-dimensional interactivity might mean.
Okay,
For
thanks for
people.
that.
Yeah,
But-
for
yeah.
people.
And that I think relates directly, Peter, to your point about microservices as well. That's the same piece. Is there anything you'd like to add to that, Peter?
Yeah. I think this is interesting because for those in the IT world, we've long talked about virtualization, and then we've all talked about how we can quickly build an app. The following day, you've had 1 million hits on your website, and you've done all of this. But obviously, within the healthcare sector and with the privacy of patient information as the primary concern, then there's a different approach to doing this. But microservices basically gives you that approach where the telecoms guys have took 2 goes to actually go fix this. I think they're there now, but basically take those IT concepts of quickly running up an app, getting it up there, connecting it, just getting it out to say 2 million people on their phones or on wearable devices. But the microservice is effectively a container. It sits within a protected environment. It has connections to the 5G network itself, but you put your app inside that. So you get the instructions on how to build your app, all the connections you've got. You don't need to worry about that in some sense. You get the data, you push data out, you do things as you're told, but now you have the freedom to do lots of different things. So if you wanted to connect to 5 million wearable devices, then you could do that. And you just build the app to do that. You let the telecoms guys figure out the infrastructure that's needed there, and then the security mechanisms and all the connectivity that allow you then to actually provision, to use their words, provision that out to those millions of devices. And that's something I looked at 2 years back in terms of the pharmaceutical industry. One of the key areas there is adherence. In other words, you and I get a prescription for a drug, but we stop it 2/3 of the way through. So what the pharma industry is interested in is there a simple method where they can actually engage with the patient while they're taking that drug, ensure that they actually take the drug for the whole period, get that feedback, but do it in a safe, sensible way. Now, their challenge is to do that not just in one country, multiple countries across multiple health systems. That is still a long-term objective. In the short term, technically we could do it, but there are some long-term things we need to go fix first.
Could I add a footer to that? Because I'm coming out of originally e-commerce, although I've worked in digital health for 10 years. So we use adherence as well. So when I did my first digital health projects, it was really interesting to see how well it mapped, because the drug adherence and the service adherence. And so I think for me, that the notion of a digital twin, say, of your car that's sustained by a 5G network, we pretend, or massive machine communication, as Peter's just described, we have the potential for a digital twin of ourselves.
Yeah,
if that's not too scary.
Yeah, absolutely. Yeah, okay.
Not only that, Adrian, Karen, I'd add to that is the bigger digital twins, which is the whole of us. But then,
yes. I was about to add that. Yeah, thinking, because it's micro and macro, isn't it?
Absolutely, micro digital twins of whatever you're being treated for.
Yes. Well, we have a perfect example at the moment where we need meso and macro digital twins, which is in the transmission of a respiratory virus.
Right. Thank you for that. That's really exciting. I'm just going to bring in Brendan on something at the moment as well. So one of the things that we've touched on that got touched on in there was about 5G getting us out. I think, Peter, you mentioned it, getting us out into the remote and rural areas and giving us the opportunity. I mean, of course, historically, we've always seen it happen with 3G, it happened with 4G. We've seen the latest technologies roll out to the big urban areas first, because that's where commercially the providers can see the benefit coming. But I think, Brendan, some of the opportunities that you've talked about, the in-home opportunities, I think start to open up different commercial models and opportunities for SMEs and the operators, which mean that maybe the rural environments are going to get 5G just as quickly as everywhere else. Do you think, and maybe this is for all panelists to talk about, do you think that's going to happen this time round, and can we really hit those rural areas equally and fairly? Brendan, you first.
Okay. Well, I think there's two sides. One is, if you just look purely at the technology side of things, I think 5G does seem to offer all the attributes that we've been asking for in communications technologies, that could be utilized in remote areas. Because again, I think everything to now has been designed for urban areas. And when it's tried to be deployed out into rural areas, like Scotland, Northern Ireland, which are mostly rural areas, it just fails because we've got things like mountains, we've got things like that that get in the way, which are not great for the generations of signals. And we kind of got into this a couple of years by trying to use things like LoRa as narrowband technologies, which worked okay within urban areas because you could get up to 10 kilometers. But once you got outside of that, you were getting really poor signals and it didn't travel that far and it just didn't deliver on what was required. And one of those things is for healthcare to adopt anything, it needs to be ubiquitous. So unless it can be deployed for every single citizen across the region, they can't adopt that, because then you're going to have preferential treatment for people in urban areas versus rural. But 5G does seem to offer more capability. And there's other technologies that can go alongside that to boost signals and those sort of things as well. But I think we need to recognize that about 5 years ago, there was a lot of interest in this area. And the companies that went into this focused on the technology areas and left the clinicians behind. And I think this time we've got to get it right. We've got to bring the clinicians with us. The clinicians need to be embedded from day one. They've got to be able there to support us. Because again, really what we're doing is bringing lots of data back from homes. And at the moment, healthcare swamped with data, even within the networks that they have. So if you're looking at, maybe potentially thousands times more data coming in, we've really got to be able to understand that, analyze it, and do something with it. We've got to create interventions, we've got to create impact, and we've got to create better results. So we've got to bring the clinicians with us. We've got to recognize that this has failed in the past, so we've got to kind of do it different, and it's not all about technologies. And we've got to get things like, we've seen other projects that fail because companies have tried to keep it proprietary. So this thing needs to be an open architecture. Not one company's going to dominate. We've all got to work together. We've got to share capabilities. We've got to interoperate. We've got to make this easy for clinicians to adopt it. And we've got to build things like security and compliance embedded within the applications and within the systems, because without that, clinicians just can't use it and will refuse to work with it. So I think we've got to get a lot of foundations right. But if we can do that, and we do that by working together, by collaboration between universities, SMEs, large companies, and healthcare, to try and solve some of those problems together. And I think, if you look at the UK 5G working group, by having these workshops and things like West Midlands and whatever else, and Liverpool and Brighton, that's really a good place to start with. So, let's collaborate, let's try and make the best of these opportunities, but we need to do it together.
Thanks, Brendan. Just before, I see the questions are starting to flow in now, just before we turn to the questions, Mohammed, could I just go in a slightly different direction? We focus, because most of us are enthusiasts here, we focused on the benefits that 5G are going to bring. Could we just talk a little bit about some of the risks, perhaps, the other side of the balance here that's in place? And please, Karen, Peter, and Brendan, please add to whatever Mohammed says.
Yeah, so indeed, and I think the first risk starts as a linked comment with what Brendan has just been elaborating. So 4G to 5G transition provides us an opportunity to overcome rural-urban divide simultaneously on two fronts: digital divide as well as healthcare divide. If we can make the digital technologies cater for healthcare needs as well. So, but it also poses a challenge as well. So if we are not providing rural areas with good grade 5G or high-end 4G connectivity, then the transition might not work very well for a majority of the population. And the other important barrier or challenge or risk is not taking care of privacy preservation of the data or security of the data, because that's one of the main barrier or challenge. If big mishaps can happen in early stages of this adaptation, that can really put off general public from using digital technologies for their healthcare for a long time to come. So we have to make sure that we have sufficient systems and mechanisms in place, and technologies are developed to ensure privacy preservation of any data, healthcare data, that will be collected through 5G. And other important aspect is sometimes people overly focus only on high speed connectivity or mobile broadband or enhanced mobile broadband aspect of 5G. But Internet of Things related technology that someone mentioned, LoRaWAN, they are part of the 5G ecosystem. And they do touch the 5G triangle from the point of view of massive connectivity or massive machine type connectivity. So they should be given equal importance and equal relevance to this as well. And this also links to one of the comments that Karen just mentioned about softwareization of the system. And she highlighted that this really brings in security and that aspect, which is right. But at the same time, it brings in another opportunity as well for SMEs and other businesses to be able to contribute to 5G deployment and maintenance, which is the aspect of intelligence in the system. So now hardware is still there. We are not replacing hardware with software. Hardware is still there. We are just creating another layer of virtualization on top of that hardware to make our engineers more capable of tuning the algorithms, tuning the hardware deployment remotely, creating slices, dedicated slices for a specific type of services remotely. So all that capability can really transform how businesses can work. So that can be a big enabler to this time not missing the blind side and deploy 5G in rural areas as well, because a lot of cost will come down, because now you don't have to send engineers to set up those physical hardware from time to time or more frequently. A lot of softwareization can be controlled from remote areas. And even if network starts to malfunction, you can still diagnose and heal the network using software techniques. So that's the so-called self-organized networking. So self-organized networking will really enable rural deployment as well. And final point I would make is we should not miss this opportunity to have a public-private partnership, bringing all the stakeholders together, because for rural deployment, sometimes a different model works very well, which is to have a community-driven network infrastructure. So if everything is softwareized, self-organized networking is there, so you can come up with a toolkit and list of instructions for a local body, combined with some investment from local people who will benefit from this technology, to deploy network of their own, right? With the if mobile network operators do not see an immediate benefit in deploying that network on a remote island, for example. And this is part of a DCMS funded project that we are involved in here in Scotland, which is 5G New Thinking, 5G NT project, which is a successor of 5G Rural First project as well. But the main idea is to develop that toolkit and set of instructions and that know-how, which will allow rural communities to be able to deploy network of their own by mobilizing their local resources.
Lovely, thank you very much. I was going to ask each of the panels to comment, but we only have a few minutes left and we are getting a mix of technical and health questions in. So let's start with a technical one. Been asked the question about blockchain and whether 5G will be a key technology for enabling blockchain technologies. Anybody fancy answering that question?
Sorry.
Karen, if you want to go.
No, go ahead.
Mohammed.
So, I did mention a couple of times privacy preservation. So blockchain as a technology, or more general, in a more generalized manner, distributed ledger technology is a very powerful tool to ensure privacy preservation. But there are two challenges to it. Blockchain is well-established technology on wired network. It relies on nodes which have high computing capability, as well as it relies on reliable communication links. When you try to transport it onto a wireless technology like 5G or Wi-Fi or any other wireless technology, there is still some research to be done to establish new algorithms and protocols which can run on low capacity nodes like IoT type of devices, and which can also cater for unreliability, underlying unreliability of wireless link, and still do a distributed ledger like blockchain is.
Lovely.
Could I add to that? from the human factors end, DLT seems an ideal way of tracking and monitoring complex multi-touch point interactions that need to be centered on something. However, there is certain moves already to tokenize social data, which is obviously a huge risk, equivalent to the commercialization of the NHS X app data, which is they're all big, massive ethical and social risks that we need to be hugely aware of. We don't want to commercialize or tokenize any transactions in and around healthcare, unless of course it's within the pipeline of existing, value chains, of course.
Yes. So just a very brief comment. So it does not have to be a commercial distributed ledger. So distributed ledger technology.
No, of course not. Yeah, please, yeah. Just make that point. It doesn't, please, Mohammed, yeah.
Yeah, okay, so good, lively. So another area in here is all about ARVRMR. Will Saunders has asked a question about innovative and scalable approaches to the use of immersive technologies. Are there any great projects, organizations, companies you'd recommend looking at who are doing great things in the immersive world?
We have some examples next week.
Okay, another plug for next week. Great.
I would also invite people to join our discussions next week. We do have some projects that we have completed with the mixed reality, AR, VR.
It's too much to share, isn't it, in a short format?
Yeah, okay. Question about the use of 5G in clinical trials. Do any of the panelists see opportunities? Peter has his hand up, so the answer, Peter.
Yeah, no, I'll take a look at that. I mean, I looked at this with the pharmaceutical industry, and one of the challenges that they have there was they want to actually reach out to the individual, the patient, but there's no direct connection mechanism. So one of the things that we took a look at was how 5G may achieve a better solution. And it's almost effective. Also, if you had 65 million people in the UK, you want to connect them overnight. So you connect them all simultaneously, but at the same time, keep them in active communication. And this is very much making the patient feel as though they are an individual and they're actually treated as an individual. So you can do this through the massive communication approach. So the patient feels as though they're connected, they feel as though they're receiving feedback, etc. The delivery of that connection and the feedback may not always be human. Yeah, it may well be AI and other things that are actually sitting behind all of this, but it actually brings the patient much closer to the care system, and maintains that contact such the patient feels in a slightly better place than would be if they just get a letter every 3 weeks from their GP or something. So yeah, there are some things in and around that, and the pharmaceutical industry is looking at that as part of trials for drugs.
Lovely, thank you, Peter. We've got an interesting question here about what mitigating actions the panelists might suggest to quell some of the misunderstanding and consequently reticence from the population in adopting 5G-enabled solutions, and some of the complex issues around that. And the end of the question says, often the social science aspects of technology rollout is overlooked and so contributes to low confidence and adoption.
Yeah. If I may, actually, just because it is a very human factors, I think when we see the level of fear that we've seen around 5G, and I know it's contextualized by the accelerated fear created by the pandemic, but it implies to me that there's a huge absence of education and a huge sense of disenfranchisement. So one of the things Mazir and I were discussing was the need for, and I think we've discussed it on the working group as well, and a need for not just education, but inclusion. And, the paradigm of co-design has been around a long time, and it's well established in a lot of technological situations. And I think it's almost something that needs to be legislated for in healthcare settings.
Yeah, I would agree with that. We have found that it's essential that we involve the clinicians early in the engagement process, and we've got to be clinically led. So, so we work together in real partnership with the clinicians to actually understand how they operate, how they want to do things, what the processes are, and also involving the patient side as well. So PPI engagement as well. So bringing the patients into it, bringing the families into it to get feedback on how services are used and how you want to innovate, and get their feedback is, you know, very, very beneficial. And it takes a lot of this fear factor away, because it actually becomes their system, not your system.
Yes, and that's for all the stakeholders. It's
Yes.
the patients, the clinicians, the intermediaries.
Yeah. Okay, so we have just 5 minutes left, and my task is to summarise before I hand back to Ivona. But I think that what I'd really quite like to do is to just ask for a one-liner, or maybe two-liners from each of the panelists, just to say, for those SMEs listening in now who want to get involved, what's your suggestion on the best way that they can move forward in the exciting opportunities that are here? What would you recommend they do? Brendan.
Okay, first of all, I think it's a great time to get involved. You know, for SMEs, the important thing is, you know, you don't want to be too early and you don't want to be too late. And I think we're just at the point, you know, which I deal, where the technology is starting to settle. People are starting to become aware of it. And a lot of the mistakes and areas of concern have been removed. So it's a good time to get involved. I said the early thing for me is, if you're going to do anything, get early engagement from your clinicians, and vice versa. If you're a clinician and you want to do something new, get early involvement from a technology company or university, whatever else you need. Everyone doesn't have all the answers. We all need to work together. So collaborate and talk to people as early as possible.
Thanks, Brendan. Peter?
Yeah, that's an interesting one, because the NHS is a large organisation to engage with, but there are routes into NHS and NHS Digital. There are some specific activities that Tech UK, which is an industry body, has been running. They do have an SME track and an SME program. It doesn't cost too much to actually join with them. Once you do get in there, there is immediate and free access then to a whole set of workshops, seminars, and approaches, which would allow you to get face-to-face with key individuals. There's also, unfortunately, running in parallel to this, there's something called Giant Health, which is a grassroots conference, 5G, 4G health conference and exhibition going on at the moment. Is virtual this year, but I certainly tracked down Giant Health. Why? Because they've got this enormous community of SMEs already. And again, they have direct access into key individuals and key businesses that are working in the NHS sector. I do think there's still a big challenge there, that the systems integrators who supply services day to day, they do need to be opened up a bit better. Maybe one of the catapults could actually help there.
Fabulous. Yeah, catapult's a good idea. Briefly, Karen, we have 2 minutes left. So
Sorry, I'll be very brief. Yes, collaborate and look for intermediaries and partner with the university. We are there to shoulder R&D for small businesses in partnership, because small businesses can't do much R&D. So I've thrown my email into the sideline. If anything I've covered is pertinent or relevant, drop us a line.
thank you. And Mohammed?
Yes, I would second Karen about participation and collaboration. I would just add one more point, which is 5G is a new generation, so creates new opportunities. Even if your SME does not have know-how about digital connectivity or communication aspects, there are opportunities, because this is this time now softwareized. For example, we discussed about blockchain and other technologies as well. So there are opportunities to develop solutions or applications that will transform the digital healthcare using 5G as an enabler.
Yeah.
Thank you very much indeed. Thank you to the entire panel and to everybody that's attended. Our time is up. One last plug before I hand back to Ivona. Don't forget, if you aren't already signed up to next week's and you want to learn more, please do. Ivona, over to you.
Thank you so much. And thank you everyone for joining us today. Please do join us again next week for our next session, which will include 6 breakout rooms as well. Thank you, our panelists. Thank you, everyone, for joining us, and hope to see you again next week. Thank you.
Thank you.
Bye, everyone. Bye.
Bye.
Bye-bye.
Bye.